Hi, I'm Todd Raffel, and I'm here with John Beard. He is a longtime talent acquisition leader. I'm sure you've heard of some of the places he's worked, like Microsoft and like Amazon. You may have also heard of One Medical, where he was not long ago. He's now up in Seattle, and we're going to talk about what he's doing there at his healthcare organization there. We're going to talk about what their challenges are there and what they're doing about it. So, John, tell us what you're doing now. You've been there about 8 months. Neighborcare, tell us about the organization. Tell us what you're doing there.
Sure. Good to talk to you, Todd. Um, Neighborcare Health is a community-based healthcare organization. We are in the Seattle area with about 32 locations in and around the Puget Sound, the greater Puget Sound area. We are an FQHC, which stands for a federally qualified healthcare center. So that means we get most of our funding from public sources, whether it's state, whether it's federal, a lot of local grants, and then our own internal fundraising efforts. We provide primary care. We also have dental clinics. We have some clinics that provide OB/GYN services. Um, and we tend to focus on communities that have traditionally faced challenges with access to quality healthcare.
Just in Seattle area.
Mhm.
Is it urgent care, or when you say primary care, is that like you go to the doctor for your annual appointment,
Yeah, yeah. We
or
don't
both?
have any urgent care centers right now,
Right.
but we partner with a lot of the big health systems here in the area. So whether it's UW Med or whether it's Swedish Providence, uh, any of those kinds.
And the challenges in hiring or finding or attracting are what?
Yeah, well, I mean, healthcare in general as an industry faces a talent shortage, and the competition is fierce. And if you think about the kind of people that we look for, providers, whether they be MDs, DOs, nurse practitioners, physicians assistants, whether they be registered nurses, whether they be dentists, dental hygienists. Um, all of those kinds of things. And we do a lot in the behavioral health, mental health care space also. And all of those kinds of professionals are in very great demand all over the country, not just here in the Seattle area. So there is definitely not enough supply to meet the demand, both nationally and here locally. And I think a lot of that is driven by the fact that more people are hiring, more people than just traditional healthcare companies are hiring those kinds of individuals. Health tech companies hire those kinds of individuals to be SMEs for whatever piece of the technology that they happen to be producing. So it's a really cutthroat world out there for healthcare talent.
Which is doubly hard for you because the pay is tougher at a organization
Yeah.
that's funded by wherever you can get the money.
Yeah, we are a not-for-profit, and we're a true not-for-profit, dependent again on a lot of public sources for our income. And that means while we think we pay a fair wage, um, the reality is, can we compete with the big healthcare systems? No, and we can't try. My former employer, One Medical, purchased by Amazon, could I compete with them for a doctor? No, I couldn't. I'd lose. So we try to focus on people that are really attached to the mission and want to be part of a community healthcare organization.
How do you find them? Or you're just kind of going out there with the mission and it's sort of attracting, or what are you finding people in similar organizations, or how does that work?
Yeah, there are some similar. We have competitors here in the Seattle area, and there are other FQHCs in the area. And as much as we kind of have a camaraderie with them, we also compete for talent with them too. So I think there's a couple of things. One, we try to focus on more and more people just ending their residency programs. And the reason being that as a provider, if you come out of your residency and go to work for an FQHC, there is an opportunity to apply to have your loans forgiven. And that's a big thing for a provider who's just coming out of their residency and has racked up sometimes hundreds of thousands of dollars in loan debt. So that's a very big incentive. So we tend to focus on those earlier in careers. And then what we have found is, what I'm going to call sunsetting professionals, sunsetting providers who tend to be towards the latter half of their career. They're not quite ready to ride off into the sunset. They've spent the bulk of their career at their maximum earnings potential, and they've reached a point where they want to give back. And working for a community healthcare organization is a way for them to be able to give back. They're probably not coming here for a full time, but they can come in as a fractional FTE and do some really good work and have some fun while they're doing it.
Who's forgiving the loan? You're helping forgive the loan, or the government's forgiving the loan?
It's a government. It's a government program.
Got it. The fractionals are on the payroll, or just
Yes.
okay.
Yeah.
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 So you're trying to find people who are interested in the mission. You're trying to find sunsetters and sunrisers. Is that right? And
Sure.
and you're doing your loan forgiveness, which is part of loan forgiveness, is part of the sunrisers. Is there anything else that you're doing to find or to attract people, or to keep people for that matter?
Yeah, I think that I think that the people here at Neighborcare Health help keep each other here, because when you ask most people what keeps you at Neighborcare Health, they're going to say the people that they work with. And it's true. It's true for me. It's true for everybody I've encountered here at Neighborcare Health. We're not a huge company. We're 700-ish employees. So it's a chance to get to know a lot of different people. I think most healthcare workers, by and large, are inherently attracted to the mission, right? Healthcare is important work, and people like to be a part of that. It's really meaningful work. Here, it's even a whole nother level. Because we're serving these communities that have historically been challenged. I mean, it sounds corny, but it harkens more to a calling than just being aligned to a mission. And the people that are here really, really are attached to that. And to have everybody here with the same North Star, no matter what your role is in the company, of being able to try and open up access to everyone, because we don't turn anyone away who walks into our clinics for any reason.
Wonderful. John Beard, I'm Todd Raffel. Thank you, John, for talking. He is up in the Seattle area, Neighborcare Health. Good luck with everything.